Hey guys, this is Dr. Hub. Today we'll look at the hematological change in terms of the pregnancy. So let's look at what increases and what decreases. So when you look at increase in hematological change, there is increase in the hemoglobin mass. So the hemoglobin mass is increased. So what else is increased? There is an increase in the total plasma protein. There is increase in the globulin. There is increase in the neutrophils as well as the fibrinogen. There is increase in the factors. By factors we name namely the 7, 8, 9 and 10. Then there is increase in the insulin. Also there is the LDL, HDL as well as the apolipoproteins. Next online, what else is increasing? There is the increase in the S transferrin. There is increase in the S transferrin and also the TIBC. Increase in the S transferrin and the TIBC. So what are the components? It is nothing but the total iron binding capacity. So total iron binding capacity. Then there is increase in the CRP, that is a C-reactive protein, as well as the placental phosphatase. So P phosphatase, as a placental phosphatase. Then there is also increase in the total alkaline phosphatase, and also if you look at the ESR, it increases 4 folds. So these are the things what are increasing in terms of pregnancy. Now let's look at what is decreasing. So what is decreasing? There is a hemoglobin concentration. So there is a hemoglobin concentration. So this is decreasing. Then there is also the decrease in terms of the S-urea, that is serum urea. There is a creatinine, creat, as well as the U acid, that is the uric acid. And there is decrease in terms of the albumin. So there is decrease in the albumin, there is decrease in the platelets, as well as the BUN. BUN stands for the blood urea nitrogen. Then comes the presence of the factor. So there is factor 11 as well as 13. There is a decrease in terms of the serum sodium, potassium, calcium, as well as the magnesium and the iodine. So what else is decreasing? There is a decrease in the serum iron as well as the ferritin.